Hi. Influenza is an acute respiratory illness that is caused by the influenza A and influenza B viruses and that frequently causes epidemics on an annual basis and occasionally causes pandemics. The drugs we have to treat influenza can be placed into two main categories. We have the M2 inhibitors and the Neuraminidase inhibitors. The M2 inhibitors is an older class that contains drugs such as amantadine and rimantadine that work only on influenza A viruses and unfortunately against which the virus has developed widespread resistance. For that reason, this class of drugs, the M2 inhibitors, is no longer recommended for the treatment of influenza, and we must depend more on the neuraminidase inhibitors. In the neuraminidase inhibitor group, there are 4 drugs registered in countries around the world. Of this class, the two most familiar are oseltamivir and zanamivir, and unfortunately certain strains of influenza virus have developed widespread resistance to this class too. Between 2007 and 2009, 97% of influenza A H1N1 strains had developed resistance to oseltamivir. And since that time, occasional pockets of H1N1 influenza A viruses have been found that are resistant to oseltamivir, appearing in different geographical locations around the world. There is also a third group of drug. A recent development was the development of drugs that inhibit the RNA polymerase. RNA polymerase is that enzyme that copies the RNA in the virus that permits replication of viral proteins and replication of the virus. And the drug in this class that is currently approved is baloxavir marboxil, which is recommended for the treatment and post-exposure prophylaxis in patients 12 years and older. Now, the other way we control influenza is through the use of vaccines. And live attenuated vaccines and inactivated vaccines have proven to be relatively effective over the years. The efficacy of these vaccines, however, depends on the similarity between the strain that is used to produce the vaccine and the strain in circulation at the given time. Apart from this, the lead time to production of vaccines is a long extended period, and this means that the production of vaccines is not something that can be done in the spur of a moment. In view of these problems, it is desirable for us to seek new therapies and new medications with a wider variety of mechanisms of action. Enisamium is a drug that is registered in many of the countries of the Commonwealth of Independent States, and the drug is recommended for treatment of adults and children for influenza as well as other viral illnesses. The efficacy of this drug was demonstrated in a clinical study that was performed in Russia, and Enisamium was found to decrease the duration of illness, the level of viral shedding, as well as decrease symptoms, both objective and subjective. Enisamium was also found to be effective in the treatment of other types of viral illnesses. Enisamium was found to decrease RNA synthesis and protein expression in cell tissue outside of the human body. Scientists still do not know what the exact mechanism of action of Enisamium is. However, Data collected during studies indicates that the drug inhibits RNA synthesis by acting on the RNA polymerase enzyme. The RNA polymerase, as I mentioned before, is that enzyme that permits replication, copying of the RNA genome in the virus. Scientists have also uncovered a breakdown product of the drug which is more potent and which is more effective at inhibiting the RNA polymerase enzyme that the virus depends on. Enisamium has also been found to be effective at inhibiting the RNA polymerase in other types of viruses as well. For example, in cell culture, it has been found to inhibit the RNA polymerase enzyme in adenoviruses as well as SARS CoV 2 viruses. In fact, patients with COVID 19 who require oxygen therapy and who were given Enisamium recovered quicker than patients who were given placebo. The conclusion is that Enisamium is a molecule that is effective at inhibiting RNA polymerase in a variety of viral infections. If this is the case, then Enisamium may prove to be an effective treatment for both influenza and COVID 19 disease. I hope you found this talk useful, and if you did, feel free to comment, share, and subscribe to the channel. And don't forget to hit the notification bell so that you can be notified when new videos are released. Until we meet again, thank you for watching.